Again, there we go. Welcome back from our quick break, and allow us to dive into the next part of our program before heading off for some lunch, if you have not had enough salami and cheese yet. The world is changing, and more than ever, our energies and efforts are being utilized to create safe and supportive environments for all those around us. Yet, the truth remains that the discussion on how to maximize and increase the scope of those efforts and energies towards creating a more inclusive and equitable environment are not being heard enough. Today, we'll hear from folks who understand and encourage the adoption of LGBT inclusive policies and practices and know the importance of conversations around this topic. They will share their firsthand experiences on how the LGBT community and our allies can work together to create a more diverse and inclusive world. Please welcome our facilitator for this roundtable back to the stage, Ms. Erica Jane Flores, who will introduce our panel for today.
I'm good. All right, of all the positions I've been in, to be in between you and lunch is an interesting one. But I welcome it because I am sitting and sharing the stage with some remarkable leaders who are truly empowering and engaging an inclusive community within and throughout and beyond the LGBTQ community. Joined with me are our friends. First, Katie with the University of California Cooperative Extension, but is also a founding circle member of Cultivating Change Foundation and has been with us from the beginning. Katie. Beside her, David, a leader here in Sacramento with the Sacramento LGBT Resource Center. Carrie joining us from Washington, but we brought her back to California because she is a California native, and with her own consulting firm, she'll share more with us. And also Marc Silva with the San Francisco AIDS Foundation. More of their formal titles and backgrounds you'll find in your program, but instead I'd like to shape our conversation where more about their work, their philosophy, their insights, as well as their call to action for each of us comes out through the questions. I've shared with them, I have a series of questions. I don't expect that necessarily they have to answer each of them, although I know they have a thought on all of it. But as always, I also want to encourage that dialogue and questions can come from the audience and also from each other. Let's get started. All right. Tell us more about the work that you're doing that is advancing the LGBTQ community. Don't pretend like either of you are shy. David.
Well, I can start. So my name is David Heitstuman. I work at the Sacramento LGBTQ Community Center. And we really work to create a region where LGBTQ people are not only safe and welcome, but able to thrive. So for over 30 years, we have supported the health and wellness of the most marginalized in our community, advocated for equality and justice, and worked to build a more culturally rich LGBTQ community. So what that kind of means is that we're working to prevent HIV, to sort of support homeless and marginalized youth, especially youth of color. We do a lot of education and outreach to healthcare providers, businesses, public agencies, schools, to try and improve their cultural competency. We also are the producer of Sacramento Pride, so the largest celebration of diversity and inclusion in the region on Capitol Mall. Each year we just had 15,000 people just a couple of weeks ago. We have a number of other events throughout the year that promote education in our community and the richness of the LGBTQ community. We provide sexual health education. We have a mental health respite program trying to help people to both prevent a mental health crisis and help connect them to community resources. So those are just some of the programs that we offer at the center. But there's a huge variety of things that our community needs because the LGBTQ community is as diverse as the community at large. And so the needs of our community are just as diverse as well. And that's everyone from small groups, children in the Girl Scouts, to LGBT elders who in a lot of cases have no one else to connect with. They didn't have children, they may have been disowned by their families, and many of their friends have already passed, and so they have a real lack of connectedness to others that can be supportive in their community.
David, here we are in Sacramento, a jewel of California, our capital. We get to enjoy the K Street, the downtown area, and I think in many ways we have successfully accomplished the hidden and more vulnerable communities, like our homeless friends in the city. Can you paint that picture of what homelessness looks like in Sacramento, but even more specifically within the LGBTQ community?
Sure, absolutely. I mean, I think there's a common misperception that because the LGBTQ community is much more visible on television and in popular culture, that safe places exist in workplaces and homes. That just isn't quite there. So we have really affirming public policy at the state and local level in California, but the reality is that 40% of homeless youth are LGBT identified, that 90% of transgender people report harassment and abuse at work. If they're able to get and find a job at all, about half of them are unemployed to start with. Well over half of new HIV infections, and you can talk about this more, I guess, as we go into this, are still amongst young LGBT folks who a lot of them don't know that they're infected. There's just a lot of misperceptions about that. We have PrEP and we have drugs that can control HIV, and so these things aren't issues anymore in our community, and that's just not the reality. The reality is that people are still struggling. 20% of lesbian couples live below the poverty line. I already mentioned LGBT elders. So while we've received some level of recognition as a community, the disparities that exist within our community and the things that are still significant issues in our ability to be able to not only be safe and welcome, but to be able to thrive in our communities still continue to persist.
Thank you.
So thank you for having me. I'm very happy to be back in California. So I'm a scientist by training. I started out my career as a veterinarian and then branched into some social and behavioral sciences. And I think what has driven the work that I do now is a mandate from my dad when I was growing up, which was when you see injustice, and I think Ben might have spoken to this earlier, when you see injustice, you either step up and do something or get the heck out of the way so that somebody else can, because otherwise you're interfering and you're complicit. So I had sort of maybe some blinders on in that I would see people as people first and, kind of vaguely recognize diversity, but couldn't understand why that diversity was a problem because it seemed like such richness. So the work I do now, combining science and social science and behavioral science, is really global in nature, and it's interesting the conversations we're having around rural versus urban, access to services or healthcare or different populations. So a lot of the work that I do is international. So I may be working with ex-child soldiers and ex-combatants in Liberia or mahouts in Thailand who are sort of the lowest caste of society, the elephant caretakers. And the issues of wanting to have meaning making and wanting to find common ground and have a life and do good and understand who we are and our place in the world is so universal. And it's that diversity of thought and understanding that helps us navigate the world with each other and for each other. So again, being a scientist, what I do with my work is I take very specific communications, outcomes-based communications and decision-making frameworks and help varied stakeholders get together and find that common ground and develop that shared understanding. And it's really pretty amazing when you find that people find that they have far more in common than they do that's different, but also a way to navigate that with civility and humor and grace. And, when we're talking about, I am often putting together international teams to go do rural agriculture development in developing countries. One of the things we have to be really careful with our team members is if we have somebody from the LGBT community going to some of these countries, it's simply not safe. So we take a lot for granted in this country. I'm not saying it's safe here all the time, but we take a lot for granted here, and to really be thoughtful about how we're preparing people and how we're helping allies understand we have a moral obligation to really help people be safe and be able to do the work that they want to do and live the lives that they want to do, but safety and security always come first.
Can you hear me? So I work for the San Francisco AIDS Foundation. I work in administration, operations, program management. And for the past 35 years, the foundation has really stepped up to address the issues that have plagued the LGBT community, specifically HIV. And our services range from preventative services, treatment services, social support, and mental health and substance use, because all of these things that affect us play a role on HIV. And so you can't think about HIV as one specific issue that we face. It's combined with all of the other issues, and so that's a little bit what we're doing, and it's incredible work. We are about to celebrate 35 years of activism within our community, and yeah, that's it.
Not that I'm suggesting you know what 35 years ago looks like firsthand, but how does the organization describe the impact of their work and efforts from its inception to now on the heels of a 35-year celebration?
Yeah, so the way we kind of describe our work is we attempt to remove any barrier possible to accessing care and treatment, and also accessing preventative services. So in San Francisco, we're really fortunate to have a city that is rich with lots of community partners and corporate partners to support the services that we provide. However, it's very clear that in rural communities across America, those services are not available, and healthcare industry across America is not equipped to support the LGBT community in a lot of ways. And so San Francisco AIDS Foundation is really working on, within the city, addressing those issues, because we were impacted so heavily, but now we're really starting to see that it's going to take a larger step outward and really trying to address what that looks like across America.
Thank you. Katherine?
So, how many of you have been involved in 4-H at some point in your lives? Great. When I started with the 4-H program 4 years ago, I noticed that there was an invisibility in my local counties around youth participating in the program and adult volunteers in the program who identified as LGBTQ, as well as in colleagues across the state of California. And I looked at that situation and I said, how can I make a difference? What can I do to inspire change? And it's my vision that not just in my counties where I live in San Luis Obispo and Santa Barbara, not just in the state of California, but that across the country, that 4-H will be a safe and welcoming environment for all youth and adult volunteers and staff who identify as LGBTQ+. And so I hope through this panel discussion I can share with you some of the work that we've been doing to accomplish that.
Katherine, being that I grew up in your area, Santa Barbara and San Luis Obispo area, what are those action items? What are either those programs or policies or ways that 4-H is creating that inclusivity?
So it started for me with just realizing that there was no conversation happening. Nobody was talking to our adult volunteers. Nobody was talking to our youth. And so I started having conversations in my local communities about how are LGBTQ youth represented in our 4-H program. And I started talking to our state administrators and saying, how do we support them? How do we create an inclusive environment? And I realized there was no training happening at the state level either. And so I started offering those trainings. And that was a challenge for me because I felt like as an ally that I was taking somebody else's space, that I was telling somebody else's story. And what I realized by doing that was I was actually creating space for other people to tell their story, to come forward, for my colleagues to come out in our organization. And through that work, I've had people across the country, different program leaders, so people who are running 4-H in different states, as well as the USDA, coming together through a variety of platforms to create policy and guidance around how to create safe spaces for all 4-H youth. So to answer that question, it's both policy work. We have new guidance that's hopefully going to be coming out in the next 3 months from the USDA for all of the states about what does it mean to be an inclusive environment for all sexes, gender identities, sexual orientations, and gender expressions, as well as training and advocacy and having open conversations and brave spaces for people to be able to ask questions and tell their stories.
Thank you. Marc started to touch on this, but for all of you, how has the LGBTQ community evolved over the past, say, 30 years? And in what ways are we falling short?
I guess I can take this one. For the past 30 years, we've made huge strides in things like marriage equality, which is an incredible feat for such a short amount of time, considering 30 years ago you probably couldn't say the word gay. And most of you, or some of you probably already know that. However, where I feel like we fall short are addressing the needs of queer people of color and also the trans community, where they're the most vulnerable. They are more likely to be victims of violent crimes and sexual assault. They're more likely to receive an HIV diagnosis. They're more likely to not even know that they have HIV for some time. And so really, as kind of I see a lot of people in this room, mostly white gay men, and we really have to take the reins and be leaders and really hold space for those communities, because they're a part of us, whether or not we like it. These people are in the alphabet, you know, they are the T's and the Q's and the L's and the B's, and we have to really hold space for those people because we're in it together.
I couldn't agree more. I think that in the last 30 years, a lot of things have changed for our community, but within the LGBTQ community, there still remains a lot of discrimination and a lot of prejudice and a lot of things that exist in the community at large. A lot of our gains in terms of public policy have really occurred over the last decade, even less in a lot of ways. And sort of what I mentioned earlier is that while we have affirming public policy, we're still missing that real community level, person on the street level affirmation and ability for service providers to provide service and to understand and to really know what the issues are that arise as an LGBTQ person. You mentioned San Francisco and the various partners that you all work with and the vast number of resources available to LGBTQ community members. But here in Sacramento, if I go online to the LGBTQ Physicians Association and look to find a primary care provider or any care provider, exactly zero come up. So it's not just in rural communities that we lack resources or people that that are sort of out and proud and able to provide services for our community. It's also in some of the more urban areas. Here in the most progressive state capital in the country, we still lack a lot of that understanding. I mean, I think it's great that you have so pervasively worked through your organizations to bring training to folks, and I think that that's something that we need at every level of our society, that there's just, even within the LGBTQ community, there's a lack of understanding of the B and the T and the Q and the various issues and intersectionalities with people of color and various other parts of our community that really have a much, much more difficult time than I do as a gay white man.
One of the other things that I've seen really change is just the access to information that youth have. It doesn't matter if youth are living in rural communities, if they can get onto social media, if they can get onto the internet, they have a wealth of information available at their fingertips, and they're having some amazing conversations about what their identity means and how do they identify and how can their identity change over time. And I think if you look at just the concept of gray A's, if you're thinking about asexual, there's so many different ways to be asexual, and youth today are really owning their place in that alphabet and their ability to change their place in the alphabet.
So I was starting veterinary school when the HIV/AIDS epidemic was first recognized as a disease outbreak, and trying to sort through that, and lost many of my friends to AIDS. And so from the standpoint of somebody that's had the long view, from a personal standpoint, from a biomedical standpoint, I think the strides that we've made in medicine alone, in public health, are absolutely remarkable. And unfortunately, it's crisis a lot of times that brings us together and gives us voice. And my concern with what I've seen through the years, both in the US and around the world, is that unfortunately, unless we have a crisis, kind of my sister's a journalist, if it bleeds, it leads, right? So unless we have a crisis, sometimes it's easy to get back into that insulation where we're back in our own sort of siloed communities, and we somehow lose an ability to talk to our allies about what the ongoing needs are, the things that you're addressing with lack of services or access, and it's the same around the world. So how do we get to the point where we keep this momentum going? My goal is always, let's try to do something before we have a crisis or a disaster so that we're prepared, because that gives us resilience. And we can do that together. So I don't want a crisis, I'm not saying that, but I would like us to find that spirit, that enthusiasm, that real willingness to work together that crisis brings without having a crisis.
Inevitably, in our personal lives, in our professional work, we are sitting at the table or coming into contact with those that don't agree, that are not at the same place we are on our own journey, or just are flat out not supportive. Can you describe one of those moments in your life and how you've worked through it, introspectively as well as just right there in the moment?
So people, I've heard people talk about California as being like the Shangri-La for youth. And with my work across the country, at first when I hear that, I kind of push back a little bit because of all of the things that you're talking about. I still see a lot of problems on a daily basis in California. But with my work across the country, talking to people from other states, I really understand what that means and some of the challenges that other states are having, and the fact that a T identity, being transgender, isn't a possibility for people in some states. Right, so I think California is Shangri-La in some capacity, but as I'm doing work around the country, what I have come to embrace is a concept of a brave space instead of a safe space, which allows us to recognize the fact that we may encounter people who say things that are hurtful to us. We may say something that's hurtful to another person, but if we can come together from a place of, I want to understand you as a human being, I want to try to connect with you as a human being, and I'm going to ask questions or have a conversation with you to try to allow us to do that. And knowing that we all want the same connection, we all want the same understanding, we can allow people to be at different spaces in their journey, which can allow us to have some shared meaning and hopefully move forward together.
Yeah, I think having a little bit of humility in these conversations, but also having the courage to stand up and say something when someone says something that you don't agree with, or is not affirming to you or to your community or to people that you know. Or even people that you don't know. And every day we have opportunities with our coworkers, with our employees, with the vendors that we work with public agency people, we encounter dozens and dozens of people every day. And unfortunately, the most marginalized in our community consistently and constantly receive little microaggressions against them constantly. And usually because no one has stopped to say, hey, it's not, you might think about addressing that person differently, or you might use this language. It's not just the gay community, it's the LGBTQ community, and provide them the opportunity to learn and to understand the community more. I mean, my experience at the center is that most people want to do the right thing. We get calls all the time from this business owner or that physician or this teacher that has encountered an employee who is going through transition, or encountered a customer who wants to change their legal name, or a client at another service provider that is going through transition, or has been a long-time volunteer, and now they have notified the employee or the nonprofit that they are going to go through transition and they want to be referred to by a different name. And the agency or the business, they don't know what to do. They want to do the right thing. They don't know what that is. They don't know the right language. They don't know the legal framework. I mean, how many of you knew that starting January 1st, every single-use restroom in the state of California is now required to be gender neutral, which means that their signage should change, that if it's a single-use restroom, there shouldn't be just a man or a woman symbol on those doors. or that every time you receive an HIV test and then get a negative result, now in the state of California, you are required to be provided information on prevention, including on PrEP. And I bet that for any of you that have had an HIV test recently, that you did not receive that information. These little things that you can take the opportunity to educate the person that's in front of you, or at least provide them an opportunity to have a conversation, I think is a good first step.
Jennifer Lilly said something that I loved and I think was really important. She said, you know, we can create spaces for fallibility. And I think when friends of mine that know the work I do get brave enough, they'll sometimes come to me and say, you know what, I don't know what all those letters mean. Can you help me understand that? And I had to learn that, right? Because I'm female and I'm heterosexual, so I had to learn that stuff, but I got my education very young from friends of mine who cared to have me understand their life experiences. This place where, I think one of my favorite phrases is one of curiosity. Tell me more about that, because I'm such a little radical at the heart of who I am that I want to respond and I want to react, and my background's in emergency and critical care, so I'm this woman of action. But that place where I can step back, and when somebody says something, you know, if it's outrageous, I'm going to step up, I'm going to say, you know, let's have a conversation about this. But that place of tell me more about that, when people say things that are harmful or hurtful, or whether they're ignorant or willful, can really open up a space to listen and hear and establish that understanding that I then need to have a more thoughtful response, and then to model that behavior. My big thing in life is train the trainer, because my goal with any of the work I do is to make myself obsolete, right? You know, you do your work, but you're building that capacity for other people in other communities. So that inquisitiveness of a child, and that tell me more about that in a really genuine way, and then listening, trying to find common ground, but to help, I hate to say shape other people's understanding because that sounds a little controlling, but to help guide that or facilitate that in a way that allows for that fallibility and is accepting that as long as we're trying to move in a positive direction, we're going to make mistakes, but we can work it all out together. It's very rewarding to see that happen.
So the key for me is be visible, and be visible for others who can't. When you are visible, it tells other people that you exist, that other people like you exist, that it's okay for you to exist. And also in that, it invites people to have a conversation, because now they know that they have access to somebody who is open to that conversation. So I've had several conversations with people about what it means to be gay and what it means to be queer. And actually last week I got kind of a random Facebook message from somebody who I went to high school with. And she said, you know, I never really thought about it until the other day, but I wanted to say thank you because you were the only out kid in high school. And I just want to say thank you for showing me that you weren't any different than anybody else. And it's kind of heartwarming and kind of random, and such a beautiful thing to happen. But that just goes to show the power of being visible, even when it was really fucking tough. Yeah.
Very good. I want to echo the importance of that visibility. You know, earlier this morning, I hope you're okay with me saying this. No, it was such a moment for me. I met John, who's an animal science student at Chico State. And that was just such a moment of pride, not only because it's my alma mater and who gives me a paycheck, but because I was a fellow student with so many of you in colleges of agriculture, where visibility didn't seem like an option, but now my colleagues are visible and elevating a voice, and I think here's evidence, right, that as a student in college, as an existing leader of agriculture about to enter our industry, that there's this space to be empowered and be affirmed. So just that visibility, not only for ourselves, but then what it means for the next generation behind us is quite remarkable. Thank you, John. The audience, what questions do you have? The only time you guys get quiet. Okay. Yes. So the question, if you didn't hear it, was directed to Katherine and being involved with 4-H, her being in North Carolina, being with Bear. How can she be engaged and involved in supporting 4-H?
There's some great work happening in 4-H in North Carolina, and I think it's true for actually pretty much every state. I think that if you're interested, there's somebody at the Cooperative Extension University who's working on this, and if you call the state office for the state that you're in, they can hook you up with those people. If they can't, because sometimes you're going to call and there's going to be somebody who doesn't care on the other end of the line, contact me and I can hook you up with them. And it just depends on what level you want to work at. Do you want to work at the state level? Do you want to help be a voice for us across the country? Do you want to work with the kids right in your community? There's a space for all of that.
That's a great question, right? And I challenge each of us in this room to be thinking about that. What are the organizations that have shaped us, that matter most to us, that we've been a part of? And how can we ask that very question? How can we be engaged in our ag classrooms, in FFA, in 4-H, in Manners, in USDA, and so on? I think that's a great question. Thank you.
As a future educator, how can I be more inclusive in the classroom with my students? Or any people of color?
The question was how to, you are an ag educator already? Future. Grad school, all right. So I guess you are an ag educator, but when you have that opportunity to be at the front of the classroom, or how do you create that inclusive space?
I mean, I think we were talking about earlier about visibility is super important. Standing on and being the person that's brave enough to say, I am an LGBT person, and you can talk to me about any issues that you might have. Maybe you don't have to say it. Maybe you just have a rainbow flag in your classroom. Maybe you ensure that you have included some level of LGBTQ history or whatever it is into the curriculum and how you teach. When you start your day and you introduce yourself to your students, lead with the pronouns that you use. So one little thing that I didn't do on the panel that I try to do as much as I can remember to is to introduce myself with my pronouns. So I would say, hi, I'm David. I go by he, his, and him. So it provides an opportunity for other people in the circle to introduce themselves and use the pronouns that they prefer or that they go by, so that they're not the ones that stand out in making that statement. And so providing that opportunity for folks to sort of self-identify and give you the opportunity to be able to identify them the way that they want to be identified is really important.
There's an organization called GLSEN, if you haven't heard of them before. They have really great curriculum and resources for educators, and they can put you in touch with curriculum that incorporates LGBTQ individuals in our classrooms. They also have a lot of lessons on how to avoid microaggressions and how to respond to microaggressions that you may bear witness to. So I think those would be great resources.
There's also some great resources through National Institutes of Health, and this came out of the field of bioethics, believe it or not, but very simple structured academic controversy exercises where there's a structure to it, there's science behind it, administrators love it because of that, and it really gives people an opportunity, students in particular, an opportunity to find common ground. It's designed to find common ground, and it's fun because you can actually assign people that are pros, very strongly pro something, the con position, so that they have to kind of walk in somebody else's shoes. So that's when, and I'm happy to share that resource with you later if you'd like that.
You stole the words right out of my mouth. We always do the pronoun game every time we have a meeting. We do a circle, just say our names and pronouns. It takes a half a second more. And that half a second really is not super important to me, but it is everything to the person in the room who is trans. And if I can do anything to make somebody feel more feel like they belong somewhere, then I will go out of my way. If it is a half a second, that is nothing. But yeah, the pronouns are super, that's exactly what we need to be doing. Thank you.
Hi, so I'm also an ag education student, and my question is, so I love ag ed, love FFA, but it's not always the most inclusive place and the most welcoming place. So what advice would you give to teachers and future teachers on how to deal with the negative situations when you have parents and students that are not going to understand your identity and they're not going to be welcome to it immediately?
I would say you lead by example. When you're working in a space where there are people who potentially make racist comments or make homophobic comments, and you have to let the other people in the room know that that's not okay, and you have to call it out. And though that's uncomfortable, it's a skill that after a while, you start to practice and it grows, and you become a little more eloquent at doing it. It's not easy, but the more you do it, the better you get at it, and the less awkward it can be.
Quick question, can you raise your hand if you are an ag educator or have been? Can you raise your hand if you are the director of the National Association of Ag Educators? If you are... And can you stand if you are the CEO of the National FFA organization? I just want to offer that right there, the greatest resource are the people sitting here in the room, and how important all of us building that network. And you've got Jennifer right in North Carolina, right there in Raleigh too. And I remember last year, I think it was during the fireside chat, that there was such a dialogue about National FFA not being present. And I want to take a moment and pause to say that what's different from a year ago to today is that National FFA is present. And so arm yourself with that as you go into the profession, as we all go into the profession and into our communities and into our industry, that there's so much need of that mentorship and those champions of change in ourselves and around us. And so reach out, and don't think that you need to be that lone soldier in the worthy work that we have to do. To finish out this panel, yes, I'm looking at my time. If the four of you could finish this statement, if only someone knew. You could finish this statement, if only someone knew.
I mean, I want to flip it around and say if only I had known. So when I was growing up in a small town in central Washington, I didn't know that I was gay. I had no idea what being gay meant. I knew it was the worst thing in the world you could be, and that it got you beat up frequently. But I didn't know what that was, or have any reference points. There was no internet. There definitely was no Will and Grace on television. Now it's in syndication and coming back to life. It's funny how these things happen. But if I had known then what I know now, if I had known even another gay person, or I had been able to see a teacher, or if there had been a Queer Straight Alliance on my campus, or a community center like we are fortunate to have here in Sacramento, some place where I could have reference points, where I could have some relatability, then that would have made all the difference in my confidence level, my self-esteem, my ability to build relationships with others, to sort of see the possibilities of the world and not be sort of cowering and hiding and lacking understanding of who I was and what I could be in the world.
Can you give me the first piece of that again?
Yeah, if only someone knew.
If only someone, everyone knew how much more alike we are than we are different, and how exciting it is to learn about that and to share that.
All right, if somebody knew how resilient and amazing the community of the LGBTQ community is, I wish that everybody knew that. The people in this room have overcome some incredible barriers to be here today. It is not easy to be out in rural America. It's not easy to be out in, queer, like being queer and in agriculture. So I wish that somebody knew how amazing and powerful the people in this room are.
You can make a difference in someone's life. You can make someone who feels vulnerable, scared, and unsafe feel welcome. And you can probably do that today, too, in this conference. So I'd encourage you to reach out and make a new friend.
Thank you. I hope that each of you walk away from today's discussion with some nuggets, some inspiration, or maybe even more questions to continue that dialogue and conversation over a meal together. I love this concept of not a safe space, but a brave space. Not a safe space, but a brave space. And I would encourage that that's what we have moving forward, is in fact a brave space to move us from not getting too comfortable and owning our voice. Thank you so much to each of you, and Marcus, Kirk,
Let's give our panel one more round of applause. And let's also thank Erica for her job at moderating this informative and interesting panel.